Today's episode is sponsored by Travere Therapeutics.
Welcome, everyone, to the Kidney Korner Podcast. I am your host, Craig Merritt. I'm also the founder and executive director of the Get in Position Foundation, where we empower and equip individuals living with kidney disease in underserved communities to take control of their health through education, counseling, and personalized support. Our motto is make sure you get in position as it relates to your health. Ladies and gentlemen, I am so excited today to have with us a young lady who's doing great things in the healthcare industry. I met her at a AKF, the American Kidney Fund event, and we're going to get into some things. I don't want to belabor the time because I know her time is limited with us. But ladies and gentlemen, please give a warm welcome to our very special guest, Dr. Amaka Eneanya. Hey, Doc.
Hey, everybody.
How you doing?
Hey, Craig.
Good morning to you.
Good morning to you as well.
Oh, and one other thing I want to mention, she gives the best hugs, folks. She gives the best
I
hugs.
claim it. I claim it. That's right.
Dr. Amaka, how are you today? Welcome to the Kidney Korner Podcast.
I'm doing great. I am doing great this morning. How are you feeling?
I'm doing wonderful. I'm excited. I'm super duper stoked, excited. I'm so, oh man, I waited for this for a while, for a minute, because you are a nephrologist, number one, right? Okay, that's your practice, and so we're surrounding it. This is very perfect for the Kidney Korner podcast, right? Because we're going to get into some kidney things, right? And not only are you a nephrologist, but you are a TikTok star.
I feel like I have a natural tact to be on media, and all my friends have been telling me for years. They're like, just own it. Like, if you see me on another interview, I might look buttoned up and real professorial, but I'm actually really silly.
Well, this is the perfect episode. Two silly people getting it on, talking about serious issues.
That's right. That's right.
So I know your time is limited with us, but I really want to jump right into a few things. It's related to Black and brown people within the healthcare system. First and foremost, let's define the difference between inequality and inequity. What's the difference there?
Yes, that's a great question. So I'm sure you've seen kind of the cartoons that they've made to distinguish between equality and equity. But essentially, to make it very simple, equality is when everyone gets the same amount, right? So if you have a pie and you divide it up into 4 slices for 4 people, everybody gets the same size slice, right? It's equal parts for everybody. Now, the difference between that and equity is, let's say you have those 4 people and you have somebody that hasn't eaten in like 2 days, right? And then that ranges from someone they just ate an hour ago. Are you actually going to give that pie the same slice to the person that ate a big meal 1 hour ago versus the person that ate it that hasn't eaten for 2 days? No, right? You're going to cut the largest slice for the person that hasn't eaten in 2 days, and you maybe gonna give a little sliver to the person that just had a massive meal an hour before. that is equity, right? That is making sure that you are giving appropriate amounts of resources or, whatever you might have you to make sure that everybody is made whole. That's the difference
Mm.
between equality and equity if you use that pie example.
Awesome. That's
Yeah.
that's a great example and analogy because we also have listeners on the Apple Podcast app who's listening to this as well. So how does that affect individuals as it relates to the kidney arena? Right? What's been going on there with between black and brown people in the kidney arena? What's been happening? Because I started off with that, so we
Hmm.
understand now what inequity means.
Yeah.
So how does that relate to individuals in the kidney arena?
Yeah, so I first let's just say that it relates to the whole entire healthcare field, right? But we'll make
Okay.
it specific because kidneys are jam, obviously.
Right?
So I think for kidney disease, what they'll teach you in medical school, what I always learned back in the early 2000s, because that's when I was in medical school, was that, Black people, Hispanic people, Native American people, Asian Pacific people, they have kidney disease in greater kind of proportions, right? Like they have more kidney disease than white people, for instance. And for a long time, people were just like, that's just how it is, right? Like they didn't
Hmm.
really think through the nuances of why would that be? And somewhere along the line, there was this misinformation that the reason that Black people, Hispanic people, Asian Pacific Island, right, Native Americans have more kidney disease is because their biology is different and makes them predisposed to having kidney disease.
Wow.
Now that we are in 2026,
Mhm.
we've had a lot of things happen, right, in society. We have a lot of re-education about what's driving those large amounts of disease in those communities, and it's inequity, right? It's the impact
Mhm.
of systemic racism. It's the inequitable distribution of resources that has been made by design in this
Yeah.
country in particular, right?
Yeah.
And so if you think about our pie example, if you have less resources that have been given to your population over decades,
Hmm.
you're going to be more predisposed to disease because maybe you don't have health insurance, or maybe you don't have access to healthy foods, right?
Hmm.
Or maybe you can't afford your medications that treat your diabetes and your high blood pressure, the number one and two cause of kidney disease in this country. Those are how the inequities are manifesting as greater amounts or greater prevalences of kidney disease in minoritized communities. It's not because of any biology.
Okay. All right. So since you said that, right? So Dr. Amaka, here's where it goes left, right? Here's where it
Let's
goes
go
left.
left.
Let's go left. So because there's the other side to that. Yes, that's true. I believe you. I've experienced that. Family members, I've seen it, right? Because I've dealt myself with kidney disease for 26 years,
Hmm.
right? Okay, so November be 3 years for me, post kidney transplant. All right. So what's the other side as far as our peoples and our mentality with that? If we understand, oh, we don't have this, we don't have that. What's up with our people? Because I've seen that too, especially in the dialysis center. I'm like, why y'all don't get yourself together?
Hmm.
You know what I mean? Come on,
Hmm.
ask for it. Find how could I say this? Let tell the viewers what how can we change our mindset, right? To seek after more and wanting more.
Yeah. I think honestly, it starts with like podcasts like this, right? It starts with my social media platforms at Amaka EMD. You can find me on Instagram and TikTok.
There it is.
But really, you don't know what you don't know,
Uh,
right? Let's just take a very real world example. For a long time, I didn't really know how to like manage money, right? Like I didn't have
Mm,
people in my family that were grades, and I
right,
was just,
right,
kind of
right.
just going by what maybe my friends were doing at that time when I was much younger. And so that's what people do for health as well. Like you look in your network, right? If you have a bunch of people in your family that have diabetes, kidney disease, stroke, on dialysis, and no one's gotten a kidney transplant, you're gonna be like, well, that is what it is, right? Like
Yeah.
my daddy, my friend, my church member. So I think it really starts with these type of platforms where you see faces that look like yours, right?
Mm,
And people that are like, look, I get it, right? Like I understand why you have that mindset. However, here are some tools that you can use to advocate for yourself, because honestly, the health system is already complicated to navigate. We
yes.
already know there's a ton of bias, right? A ton of
Yeah.
unconscious bias. People are
ab-
just going to route you to dialysis and not even really
Yeah.
think about it, right? And so you should be the one to be like, hold up, hold on, right? Before I go on dialysis, what are my other options, right? Time out. And I think it starts with, and I'm getting such good questions on like TikTok and Instagram. So people have just never heard this information, unfortunately. Where are they going to get it from, right? It's not
Right,
on where, like maybe the local news will show it like once
right,
every 2 years.
right.
So I think it starts with platforms like this and really spreading that information.
Okay, great. Awesome. See, all right, you right on time because you segue right into the next question I got. So on your platform, on your TikTok platform, you mentioned something that I want you to get into and talk about because what you mentioned actually affected me. It was the reason why I was on dialysis for 4 years and my time was adjusted. This happened in 2023. So that's key, folks. 2023, something happened in the healthcare industry, especially as it relates to transplant. So on your TikTok, you have like this little 2 or 3 part series where you talk about you actually helped 23,000 black people get better access to a kidney transplant. Talk about it.
Yeah. So, and for the audience, that's why I gave Craig such a warm hug, because he just made my whole day telling me his personal story with his kidney transplant. Um, but for a long time in nephrology, one of our main tools, one of the main ways that we diagnose and manage kidney disease is in a lab equation called eGFR.
Mhm.
And for 2 decades, I mean, starting in 1999, they had one for Black people, an equation, and then one for everybody else. That's just how we did it, right? It was based on some
Yeah.
rigorous research published in one of our most prestigious journals. And that's how people operated. Now, you know, I'm gonna ask questions, and I have 3 brothers. I'm the only girl out of 3 brothers, and for my whole life, they've been like, "You ask too many questions. Like you're so annoying." But that's just how I operate, right?
Right.
And so I always had that in the back of my mind. But as a busy resident and trainee, and
Mhm.
renal fellow, nephrology fellow, I just was like,
Yeah.
that's just how it is. Now, fortunately, I was in a healthcare system where that wasn't in my face. I had to pull out my calculator and do some
Mhm.
calculations if I really wanted to use that Black equation. So I was in Boston during my training in my early faculty years at the Harvard Hospitals, Massachusetts
Mm.
General Hospital, Brigham and Women's Hospital. Then I took my life and went to Philly, where I'm from, because I had some illness in my family.
Okay.
And when I went to Penn, they had it in my face. It was like Black, not Black. And I was like, oh, wait, hold up. Like,
Yeah. Time out.
time out. I couldn't eat more anymore. And
Right.
so I had heard one of my best friends from residency, who's not a nephrologist,
Mm.
was doing that work in Boston. And actually, her and some medical students threw it out of the healthcare system. Right. And I was like, oh, I'm inspired. I'm nephrology, and we're not even doing
Yeah.
this in our field.
Yeah.
So I wrote about it when I was at Penn Medicine with my colleagues about how it was wrong and how we needed to change it. And that was in 2019. And that is where my life took a sharp left. And I just started getting all types of input. I was like, wait, me? Like, I'm supposed to be the one that's talking about, they're like, you. Because
You.
at the time, Craig, I was doing research like about quality of life and why, for Black people, why do they make different decisions about dialysis or at the end of life? I was in a very different academic mindset. So to kind of
Right.
shift to eGFR equations, which is much different,
Yeah.
I was a little intimidated.
Mm-hmm.
However, I had to do it because, like many Black people, I had someone very dear to me with kidney disease in my family. That person's my father.
Yes.
And I remember at the same time I was getting to Philly, I, took him to an appointment, and I was going toe to toe with that nephrologist because she wasn't going to list him for a transplant. And I was like, hold on, he's getting worse. And she's
Right.
like, well, with the Black eGFR equation, he looks just fine. He will be just fine. And we don't want him to get a kidney transplant when he doesn't need it. And this is why I had to flex.
Let me stop. You didn't take off your earrings and pull the Vaseline out your bag, did you?
My dad is a very quiet, introverted Nigerian man. Okay. He was
Nice job.
looking uncomfortable because I was like, well, let me flex on you real quick. I trained at Harvard.
Right.
Like, I've got right. It got to one of these and it got real tense.
Yeah.
We walked out and I was like, Dad, you're never going back to that clinic again.
Right. Right on. Right on.
And so, and that's how, like, that was the kind of personal story for me to like get in the game and start this fight. And people are probably wondering, like, why was it a fight? Oh, child. OM is a fight. Okay.
Yeah.
A lot
my
of
dad,
people, they did not want this to happen. They did not want this change to happen. They said, you guys are going against the science. You guys are woke. Like, this is sad. We get it's sad, but this is science. And I was like, hold on, me? Like, I've been trained in science too, the very best institutions in science. So it got really messy, but that just fired me up more and more every day to keep going until this change happened. And they took, Black race out of the equation, had a whole new equation I was also a part of, new recommendations and new federal policies to help Black people get better access to kidney transplants. So I just gave you the Cliff Note version on that. It's a long story.
I know it's a long story.
Years.
Yeah. Because the first thing is I don't understand. They kill me when they say you woke. I mean, so you want me to stay asleep? That's what you saying? You want me to stay asleep? You stupid for that. But anywho, when we talk about that eGFR, just like you, when I was diagnosed back in 2000, stage 3, and back then it wasn't broken up in 3A, 3B. And I actually was on stage 3 for 18 years. And then it just rapidly, and not to mention I was diagnosed with a rare kidney disease, FSGS. And so I always question that line item when it came to my labs, because I was taught, I had a really great nephrologist at the time, and she intentionally taught me how to read my numbers, how to read my labs, understand what each of them meant. And I always questioned, why is there an African American one and then a regular one? Are we different? And she really couldn't explain it to me, to your point. And so I always knew something was up. But in 2023, I received a call from my transplant facility, MUSC in Charleston, South Carolina. And that mandate was made. The policy was changed that they had to go back in and readjust everybody's time. When I say everybody, I'm talking about Black patients, folks. Black patients. I waited for 4 years. Actually, physically in the natural was 4 years, but my time doubled to 8. And so I was moved from the bottom to the top. I received that call, Dr. Amaka. I received that call on a Friday to say my time was adjusted. That Sunday, I got the call for a kidney. That Sunday. That's how quick and fast the turnaround was. So That's amazing.
That's beautiful.
I always say to
It
God
always
be the
just gives
glory.
me like chills
Yeah.
that I'm hearing this story. Seriously, that you're so blessed. Thank
Yes.
God.
Yes. To God be the glory for
Hmm.
that. But yeah, that was a nasty equation or formula that was going on. A lot of our forefathers and mothers passed away waiting on treatment. And the crazy part is it was deliberate, it was intentional. It wasn't that's the way it is. No, that y'all knew what. Anywho, you limited time. I ain't gonna get into that. I'm get off my sofa because we can really get
we can
into that.
really we can really expose some
We can
people
expose
too.
some folks too,
You
but
know.
neither here nor there.
Hmm.
We'll move on.
Hmm.
So I want to talk about some practices, some best practices that we as Black and brown people in our community can do better when it comes to going on our doctor's visits. What are some of the things that, and I just want to break it down because we on the corner, right? We just
Hmm.
hanging out chilling, right? And
Hmm.
so, Doc, what is it that annoys you the most when we come into, because we got to get it together, folks. We have to get it together. We already talked about the inequity,
Hmm.
but there's things that we could be doing better. Talk about, some of the things that you're seeing and maybe some trends that we need to get rid of and we could possibly do better as it relates to not just our health, but just going to see the doctor, period.
Hi, my name is Nakia Davis, and you're watching the Kidney Korner Podcast.
Yeah. Well, for sure. And I think for kidney disease in particular is silent. Until you need dialysis and you're like, oh, right. And then it's just so overwhelming. It's devastating. You just learn that your organs are failing, right? And
Mhm.
so before you get there, and this is why I've jumped onto TikTok and Instagram, I'm like, there's so many things that you can do, but you just have to know that even though it's silent, your body is getting beat up. And so I put that in one of my videos, like diabetes, extra sugar in your body. You might be like, I'm fine. No, that sugar is beating. I just think about sugar beating up your kidneys with boxing gloves, and then you have high blood pressure on top of it.
Right.
Just, I mean, that's like Mike Tyson, right? You're
Right.
literally beating up your tissue,
Oh,
and there is no way to fix it. Like, and for the kidneys,
right.
people get it confused with the liver. The liver can regenerate beautifully.
Yes.
The kidneys, once it gets beat up, Mike Tyson,
Done.
you are scarred. Your kidneys are scarred down.
Done.
There's nothing to regenerate that tissue to make it nice, healthy, and
Right.
fresh.
Right.
So once you have that damage is there. If you
Wow.
have diabetes, high blood pressure, and then, like you said, there's a whole bunch of other rare diseases. So I need people to know that you have to be strict. Okay, strict program, as they say. If you have diabetes, I need you to be competitive. Like, you know what? My hemoglobin A1C is 10. I'm gonna get it down to 7. Set a goal for yourself. I mean, so
Yeah.
that motivates me.
Okay.
And I'm an athlete, and so it might be different for somebody else. But I want people to start setting goals for themselves. Your high blood pressure is not at the numbers that your doctor says. You say,
Hmm.
on 6 months, I'm gonna have that at goal. In 6 months, I'm gonna have that diabetes, hemoglobin A1C, and go. So I know that my sugars are in check. It starts there. Like, you got to push yourself. And I want to be clear that I try not to blame people too much because one, they don't know what they don't know.
True.
And two, because we have inequities, and what I've seen in my clinics is that people will come in, numbers all out of whack, right? And they're worried about their lights getting cut off, or they're worried about their son
Mm.
who just caught a case. I mean, that's going to shoot your blood pressure through the roof, and you can't even like,
Uh,
you may not even have the medication to like even get the refill, right? Because you're dealing with like all
life.
of life stuff,
It's
right? And
life.
so you may not feel safe in your home. It might be a
Ooh.
violent environment, right? There's
Mm,
a bunch of things that just pull people
mm,
away from their health. So I do know that I speak from a place of privilege. I live in a safe neighborhood. I can walk where I want to walk. Not everybody I can buy the foods that I want, right?
right.
So I think it does have to be contextualized in there are a lot of systemic factors that make it very hard for people to focus on themselves in the
Okay.
United States, especially if you're a part of a minoritized group. But like I said, knowledge is power, right?
Yeah.
If you hearing this, it's going to be hard for you to turn it off
Yeah.
when you go to the doctor and he's like, your numbers are off. You're like, I
Mhm.
heard on the kidney corner that's going to beat up my kidneys. I should probably try. I should
Mhm.
try to do something. It just takes one step every single day. Try
Right.
something new.
Okay. And I'm glad you said that, because you just talked me down off the fence, because I'm just like, like a gym coach, like, get it together, do that. But thank you for helping me.
It's different.
It's different for everybody,
That's
because
right.
you're absolutely correct. And I'm glad you mentioned that, because there are outside factors that we have to consider. People like me, I have to consider, because everybody's dealing with something.
Mm-hmm.
Something is always going on in somebody's life. You may think and see a person, may think they got it all together, but they don't.
Mm-hmm.
Problems just like you and me, right?
Mhm.
Different problems, right? Different
Mhm.
problems, and that contributes to your health.
Mhm.
And also, when we, a whole nother conversation is the mental health piece, because how you think is how you feel.
Right.
You know what I mean?
Mhm.
And
Absolutely.
so, and oftentimes when we go into masking things because we don't want to deal with it, that contributes to the stress, right? Because we got to keep up that mask, right?
Exactly.
We got to keep up that mask as well. And then what is the outlet to release and let go? So that's an interesting point. Great point. Great point.
Mhm.
You spoke about a member of your family who was going through something. You talked about that individual at the symposium in
Mhm.
Washington, D.C., where we actually met, and you were the keynote speaker. How was it for you? Well, you told us a little bit that you wanted to scrap, you know what I mean? Get into it with the people. You told us that, right? No, I understand that. I get it. I get it. It's
Uh-huh.
totally it's totally
We
understandable,
don't
right?
condone violence on this platform.
No, we do not. Uh, just the disclosure of the
That's right.
Kidney Korner
That's
Podcast
right.
and stuff. We do not condone any violence, but you feel what you feel, right? You feel what you feel. But anywho, you mentioned some of that. But let's talk about the caregiving piece. And you also mentioned that you have what, 3 other brothers?
Mhm.
Okay, three other siblings. And so what is your approach, especially as a daughter or even a son, right? Because you're brothers,
Mhm.
watching a parent go through something like that.
Mhm.
Um, talk to the viewers about, or give a little bit of advice. I know every situation is different.
Mhm.
And like I mentioned, people are going through it. In our generation, we're called what? The sandwich generation, because
Mhm.
we take care of parents and our own families and trying to work and stuff like that. Talk about that experience for you and also for your brothers, caring for your father.
Yeah, so my father is my only parent. So my mom passed away after from
Mm.
complications of childbirth
Oh,
after
wow.
having my youngest brother who's 12 years younger than me. So I
Wow.
only got one left,
Oh,
right?
got
So
you.
a lot of
Mhm.
that like drive is like I only got one left, right?
Mhm.
And I want him to remain as healthy as possible for as long as possible. So to see like the patriarch of our family, right? Nigerian, kind of serious,
Mm.
overly educated, man, very classic Nigerian,
Right.
like have to struggle with the fear of, oh my gosh, like if I'm not around for my kids, who's gonna take care of them, right? Like And then us having an attachment to him and being like, what do we do in this situation? So it was scary, to be confronted with, our father having this disease that was getting worse. And like you, he had a biopsy and it was also FSGS.
Okay.
So he was able to, control so his blood pressure also was not perfect. That was a key thing for many years. It wasn't like super elevated. It was just not at goal. And people don't realize, again, there's a number of goals set for a reason. If it's less than 120 over 80 or less than 130 over 80, and you're floating in the 150s over 85, you're not at goal. You're
Right.
still beating up your kidneys. Just keep
Yeah.
that clear. So people are like, it's not that bad. And even my father was like that, right? And so it is bad. And so that's
Right.
what really, contributed to his decline, was the blood pressure not being under control for a long time. And FSGS is going to run its course, as you know.
Right.
So that was scary. And the advocate in me, and I mean, it's been studied that daughters go a little bit harder for their parents than no shade
Right.
than their
Yeah.
sons. But
Yeah.
I was gonna go hard. And my father, like I said, is a very quiet guy. He's non-confrontational. So you already know, like, the fire
Yeah.
was in me even more, to make sure he got the care that he did. And I literally, after I walked out of that doctor's appointment, I took him to Penn, where I was faculty, and I said, and I handpicked his team, based on my interactions with them. And that's where he stayed to this day. And an update, you had your kidney transplant in 2023. He was moved up on the transplant list. He was listed in like 2021. He
Okay.
got moved up 18
Ah,
months and got his kidney
nice.
transplant in January of this year. So thank God. We
Ooh,
thank
nice.
God that
Yes.
all of that came full circle.
Yes.
And I just couldn't believe that I was able to experience the benefits of my work personally, right? I heard
Right.
a lot of stories like yours. People were
Mhm.
tagging me on social media. Obviously, I continue to hear those stories from my colleagues who take care of patients with kidney disease, but to have it happen to my own father at the age of
Right.
73, so he has a new lease on life, was really
Good.
phenomenal.
Oh,
And also we talked about like what happens post-transplant. It's a very it's a very big surgery. So,
yeah.
me being there was also helpful to be a big support for him.
Good. Awesome. Awesome. That's a great story. Shout out to your dad. Um, I know he's doing well.
Yes.
With you at the helm, I know he's doing phenomenal. But
Yes.
but Doc, talk to those individuals, talk to those families who don't have a doctor in the family, right?
Mm-hmm.
Because you said you handpicked like this one, that one.
I
What when
did.
I know right?
Mm-hmm.
Right?
Yes.
But for those persons and individuals who don't, what are some methodologies, some technique, something that they could do so they could know too? What is that? I know we got Google, I know we got chat, but but how do they uh navigate through that picking? Because people, this is my biggest thing and my
Mm-hmm.
biggest pet peeve. People don't know, like you said earlier, you don't know what you don't know. And I need you guys, listen, I need you guys, because everybody on the planet is a patient, right?
Mm-hmm.
Or
That's
has
right.
been a patient, right?
Mm-hmm.
I need to know, you guys need to know that you have rights.
Mm-hmm.
As a patient, you have patient rights.
Mm-hmm.
So help some people out there who are trying to get these answers, trying to know what to do. What are the flags? How do we know how to handpick people? What is that? Talk about it.
Oh, this is complicated because I'm about to talk bad about my own field. But honestly, it's hard on both sides, especially right now, especially what we're seeing with healthcare. We know doctors have been burnt out since even before the pandemic, but it got much
Right.
worse during the pandemic. So the
Mhm.
people that are still seeing patients in clinics and institutions are working really, really hard. So I want to just throw that out there. Okay.
Okay.
So when you work really hard, the research has shown when you're burnt out and incredibly tired, all that subconscious bias, unconscious bias is going to come right to the front. Right.
Mm,
And so you're more likely to have like a strained interaction with a patient or maybe not listen when you're feeling that way. Okay. So let's just put that out there. So I think that if you are finding that you don't really feel heard, right, that
mm,
you're being over talked, right, that you're being dismissed, like you're telling them, listen, I feel this way. And they're like, yeah, you're fine. Just red flag.
uh,
Right.
mhm,
You should get to the point where you're telling a doctor like, I don't feel well. And they're like, let's look into this. Let's do these tests. Let's send you to this specialist. Let's have you talk to a social worker. Like there should be a partnership in terms of your doctor helping you along. It's never like the doctor tells you what to do and you just want to do it. You work together. It's called shared decision. This is where my research was. It's called shared decision making. You're making those decisions together to
nice.
optimize or improve your health. So if you don't feel like it's a partnership,
Yeah.
right? Like then you have a right, like you said, to request a second opinion. Now, me, and I even think that I'm like best bedside manner, evidence based. Sometimes the patient will be like, you know what? I don't like you. And I'm like, I'm not even offended. You should go where
Right.
you feel comfortable. Now
Feel
that's happened
comfortable.
very, very few times, but when it did, I'd be like, oh,
All right,
and they went
cool.
to go see my colleague. And if you have a better experience with my colleague or you learn something different, then by all means, right? Like
Nice.
medicine is an art. Like we have the guidelines, but there's a lot of kind of like what works best for each individual that you have to work through with your doctor. And
Absolutely.
so I think a way to navigate that is to go through your network and be like, who's a good doctor? Did you have a good experience? Because sometimes you
Right.
can't get that from Google and you
Right.
can't get that just from getting to that most senior person in the department because that might that might not go very well. Sometimes those most senior people they see patients like once a year, right? Like they may not see
Wow.
patients that often. So you think you're getting the top of the top, but they don't really they
Nah.
like a squeaky bike, right?
Yeah.
And so I think going through your network and being like, who's a good doc? That's how I still continue to get people from all over the country. Like, you got
Nice.
to talk to her. She knows how to talk to people. She knows how to like make it simple. Like that kind of word of mouth is what you should tap into with it's your church or your gym or your family to figure out like who is a good listener and go
Right.
from there.
Awesome. Awesome. So, again, folks, you can also hit Dr. Amaka on TikTok, reach out to her, message her, DM her. You know what it is. You got access. You got access.
That's
I, wa-
right.
I want to jump into the arena of rare kidney disease really quickly.
Hmm.
What's your take and how do you feel about individuals being tested and screened, especially genetic screening, as
Yep.
we talk about the APOL1 gene as it relates to African Americans? Give us something about getting tested, knowing your kidney numbers, the importance of that, and also the genetic testing as it relates to kidney disease.
Yeah. Again, knowledge is power. I'm a curious one. So maybe I'm going to be biased in my answer because I always want to
Okay.
know.
Right.
I've been tested, right? Like, so I have a very good friend, Dr. Opie Olabisi, the chief of nephrology at Duke. He is one of the national experts in
Okay.
APOL1. And he tested me a long time ago because I was like, look, I want to know, right? So
Right.
I know what my genetic profile is. And that actually helped with my dad's situation because he only got biopsied. He didn't, at the time they didn't have that testing, genetic testing. So once I learned that I had it, it was like, well, I mean, if it's genetic, it came from somewhere, right? And so the assumption is that he has it too.
Mhm.
And so, I think that genetic testing is very important. Where I want people to be careful, especially Black people with APOL1, is that is still being researched, number one. So I think it's good to know what your genetic kind of testing shows because there are drug companies that are working specifically on therapeutics and medications to treat specifically APOL1.
Mhm.
Where the message has to be really, really kind of nuanced is that even though people who have those genetic, APOL1 diseases, some of them don't actually progress to needing dialysis or transplant. And it's really unclear why that happens. So even though you're getting tested, I think we have to be careful to say that, like, oh, it's a genetic thing that's driving all of this disease in Black Americans. Because, like I said, the research that has been going on since like W.E.B. Du Bois in like the 1900s
Woo!
showed
Wow,
that
long
like
time ago.
the disease burden that we have in Black people is because of racism, social drivers, inequitable resources, bias. That is what's driving the lion's share of disease. Now, APOL1 is real. We've both talked about it. It's both in our family. So it is a real thing. But I don't want people to think that, like, oh, it's just a gene. And I think people could get a little confused. But it's really good to know what your profile is, not one for yourself, but
Right.
then two for the people who are after you, all of your offspring, all of your family, right? Like,
Mm-hmm.
we need to know, like, am I predisposed to this? And if I am, what can I do to prevent my kidney disease from getting worse? If it gets worse, do I qualify for this therapy?
Mm.
You know, hopefully we have one soon. I think one is coming soon. But I think it's helpful to know whether it's APOL1 or polycystic kidney disease, right? All of those genetic diseases, we do need to know kind of what that looks like. And I think the field of medicine is moving more towards, and it should move more towards, gene therapies rather than like race therapies. Race therapies are done, okay? Like, if
Right.
you can't take anything away from this podcast, race does not drive your biology. It's racism that drives your biology. And so we do need to have more specific medications to your genetic profile. And I think that's coming, especially with APOL1.
Wow. Wow. So folks, if you don't know what APOL1 is, please visit our website. We'll have something on there in regards to what that genetic testing is. We actually, at the Get in Position Foundation and on the website, we actually have an initiative to know your kidney function and numbers. And it's the initiative of Get in Position to say no kidney disease. We want you to speak with your doctors to get tested. There's only two tests. It's a blood test and there is a urine test. So you can find out what those functions are and what those numbers mean. So visit our website. So, all right. I know you got to go. I know you. We was just, we flew.
We
We
still
flew,
got some time. We got some time.
we flew through this one. What is your actual take on being on the front lines? What is your daily battles being on the front lines? When you talk about it, you talk so passionately about, race, because you're like, race is done, it's X'd out, it's 86, we 86 in it.
It's done. It's a thing of the past. Stop talking about it.
So
Now, I mean, not talking. Hold on. Let me make, because people go, she said to stop talking. When I say that, I mean, don't talk about race-based medicine, that we should get things differently because of our different races. That's what I mean. That is the thing of the past. Okay, keep going. Keep going, because you know what she said. No,
Yeah.
she
Oh,
said.
you know how folks do. You know how people
Yes.
do. So what is the front lines for you, and on a daily basis, what is your fight on the front lines, especially for Black and brown people? Because you're in it, you see it, and it was part of your study and your research. But what is the daily fight and the struggle about?
Yeah, I think, like I said, the movement to challenge race-based tools, equations, diagnostic tests, that is happening. Every field is dropping. So nephrology was the first, right? But
Mhm.
OB-GYN, cardiology, they all of them have race-based tools like that say do something differently because someone's Black, Asian, Hispanic. Those are all a thing of the past. We are moving forward. So what the fight is for me at this time is, one, making sure that people get the right information, because now
Mhm.
we got a whole wellness longevity movement. We
Right.
got people getting paid by different social media platforms to talk about what plants you can eat, what
Right.
infusions that can reverse your kids. Like,
Right.
where did you get that from?
That's
So
from
I
right.
think Like that, no, what? So
That
I
ain't
get those
tracking me.
questions all the time. I'm like, oh my. So I think now it's a battle for misinformation and getting the right information out there and making it digestible, right? You see
Right.
my TikTok. I'm joking around. I'm like, child, get to the hospital if you feel it. Like, I need people to understand that this is real and it's not
Mhm.
just some like, boring stuff that you can ignore. So that's one of my biggest challenges. The other challenge specifically in nephrology, and I have a venture coming out to help with this, is that we focus way too much on dialysis. We
Mm,
focus way too much on kidney failure. And guess what? 37 million Americans have chronic kidney disease. 90% of people don't know about it, right?
no. Right.
And guess how many people have kidney failure that require dialysis? 800,000. So that's a lot. I don't want to say it's not.
Right.
But there's a whole like other 36 million that we should be focused on and making sure they're getting all the right FDA. Been a ton of medications approved for kidney disease in the last 5 years. It's just like, oh my gosh, this field is so exciting and people don't even know about it, right? And
Right.
so making sure that people are on medications to slow down their kidney disease, because guess what? The majority of people actually will die with kidney disease without reaching dialysis. So you can actually prevent this disease from getting much, much worse. You just need to know what's causing it, how
Right.
you can control it, and are you on the right medications, diet, etc., to make sure that you are optimizing your kidney health. So the battle for me is to kind of get the field to shift upwards, right? I think we have a lot of reimbursement incentives from insurance companies to focus just on that very end stage part of the disease. Like I said, it's extremely important, and we want to make sure that those individuals are taken care of. I think the next challenge for all of us for the field is to make sure we can really truly focus on preventative
Yes.
kidney health, preventative nephrology, and that's a battle for me.
Okay. Okay. All right. So being you said that, I'm gonna tell you now, you got a friend and a partner in the Get in Position Foundation. So we'll talk offline how we can
Okay.
make all of that happen and what we need to do, because I'm on board with that as far as preventative care, preventative care, and also individuals being educated. Again, to your point, you don't know what you don't know,
Mm-hmm.
right? So for a lack of knowledge, my people perish. So we got to be educated, folks, on this. So, lastly, Dr.
Mm-hmm.
Marco, what do you want out of everything we've said and talked about and discussed thus far? What is it that you want individuals to really leave with from this episode?
I think that you have a lot of power. You have more power than you know. We talked about there's a lot of things in life that you don't have control of. We're going to let that go. Okay. I want to focus on what you actually have control over. You have a lot of control over the type of information that you receive. You should be checking the certifications of people that you see on social media. Like, look them up real quick. Where did they
Mhm.
train? Where did they get their medical
Right.
and wellness training? Right.
Yes.
I'm a little bit biased. I think that, physicians, nurses, people who are in the healthcare field are great kind of sources. I think patients who have lived experiences are great sources. If you're getting something from somebody who just like was a gym trainer and all of a sudden they talking about kidney disease. I mean, I'm not saying that they're
Right.
wrong, but you
Right.
should just be, you
Right.
want to go to the best source possible
Mhm.
for sure. And then once you have that right information, it's time to start thinking about what can I do about this? If you need help, right? If you need more resources, more support in your life so you can focus on your health, there's in whole companies that
Mhm.
focus on getting the resources that you need, whether it's fresh food, whether it's financial assistance, right? Or whether it's like looking at your housing, situation and getting you to, there's tons of programs in every city, state,
Mhm.
national level. You just got to voice it. So I want people to feel more comfortable saying, I need help. And I think
Yeah.
especially in minoritized communities, we be like, we got it. We got it, right? Our thing is like resilience, push through. And that comes from trauma because we've been doing that for a long time, right?
Yeah.
And like, yes, that's cool to do that sometimes, but I need people to ask for help. Like, look, I can't. And this is what I learned as a trainee. Like, it's embarrassing for the people to be like, I can't afford, I don't know how to read. You know how many people are illiterate in the United States,
Wow.
and
Yeah.
nobody wants to talk about it. So they'll
To
be
this
like,
day.
sure, I
Yeah.
understand. And you're handing them this paper after the visit to be like, you get it? Most people are going to be like, I got it. And they don't got it.
They don't got
So
it.
I need you to say, like, I have a hard time with this, with reading this. Can I sit down with someone who can take some time to explain it to me? I need you to be asking questions like that, or I need some resources. Like, I am stretching out my groceries like over 3 weeks. I don't eat sometimes, or I'm eating like Snickers and junk food. I need
Right.
help.
Yeah.
I need people to feel very comfortable doing that, because we can't help you if we don't know.
Right.
So those are the things I would take away. You have more power than you know. Go get the right information, check your sources, and ask for help, right?
Mhm.
Like, those are the things that we can do together to make sure that we're all healthier.
Awesome. Awesome. Well, Dr. Amaka, thank you so much. It was a pleasure. I wish we had more time.
I know.
But you'll be back. I mean,
I will be back.
you know, it's the same address, the Kidney Korner Podcast.
Sure to
You know what I'm
find you.
saying? You know how to find us, right?
That's right.
And so give people your socials real quick again.
Yeah, so it's at Amaka EMD. So that's AMAKAEMD. I'm on TikTok. I'm on Instagram. I am on YouTube. Don't judge me on my YouTube page. I'm still getting that together, but it's the same handle across all the pages. And I'm on Threads. Same exact handle. Make it real easy. Follow me for kidney facts, how to change the field, funny sometimes, some jokes. I don't know if I'm a dance. We're not there yet, but
Okay.
you can have some credible sources to learn how to be healthier and how to optimize your kidney and metabolic health.
Awesome. Awesome. All right, my friend. Thank you so much. Hang out backstage and I'll be right back with you. Thank you so much.
Thank you.
Right.
It's been a
Yeah.
pleasure.
Yes. All right, folks. Listen, I hope you got something. I hope and pray that you reach out to her. She gave you her socials. She's accessible. DM her, ask her some questions. She's doing a really great job on TikTok. And again, like she stated, with those resources, say something, speak up. Don't be embarrassed about it. Or if you guys want some extra resources, please reach out to us. It's been scrolling at the bottom of the screen. Those of you who are listening on the Apple Podcast app, of course, you can't see the screen, but you can hit us up at www.getinposition21.org, or you can email us at info@getinposition21.org, and just reach out if you got questions or if there's a need. We'll try to get you guys the help that you need. So, as always, I had fun. I enjoyed it. I learned a lot. And as always, like we like to say, make sure you get in position as it relates to your health. We see you guys soon. Take care.